Now, we're going to be getting into our conversation this morning on health, issues that we've dealt with over the period. So the whole of this month basically has been dedicated to one of the most talked about cancers, and we're talking about breast cancer. But of course, it comes with some myths and some misconceptions as well. And as time goes on, doctors have tried as much as possible to get into the details of it, so they're able to clear some of these myths and misconceptions. And today, we're wrapping it all up with that conversation. In the studio with me is our very own doctor who's joined us here this morning, Dr. Sulian Oyawoye. I love the name. She's a medical officer from Medifem Hospital, and she's going to be telling us more about what we're going to be talking about. So please do well and send your messages to us. If you've got any concern about breast cancers, there are things that you've heard. Certain people even say that when you put money in your brazier and all of that, you can get breast cancer. There are other people who also say that men should be allowed, which is one of my best myths. I don't know if it's one of them, but we'll find out. Men should be allowed to entertain themselves with the breast of a woman. And actually, it does them a lot of good because it prevents them from getting breast cancer. How factual is this? We're going to find out here on the show. Let me introduce my guest in the studio with you, to you, and then we'll come back to it. Doc, good morning. How are you? Good morning. This month, we have done so well for ourselves here. Now, first of all, let me find out from you, how has the conversation around breast cancer been for you this year? I was telling my colleagues that this year has been a bit low as compared to last year, because last year, it was everywhere. Everybody seemed to be very excited about Pink October, Breast Cancer Month, and all of that. But this year, maybe because I was out of the country, but I feel it's not really as heavy as it was last year.
Yeah, I have to agree with you. It wasn't, for me personally, it wasn't as heavy as the years before. However, I noticed that a lot of people now know about breast cancers.
Okay.
And it's it's become like a repetitive thing, which is good because that's what we want. We want everybody to know about breast cancer.
Yeah, it makes that awareness stronger.
Yeah, stronger. But then there have been a lot of charities, outreaches, and a lot of companies who have gotten involved in breast cancer this year as well. But it wasn't as pronounced as the years before had been.
Could it also be the fact that, and maybe it might not be the case, but could it also be the fact that people have really been, deep into the awareness, and so it's reduced the rate at which, it's becoming popular, if you like?
Actually, I think it's more of the economy of the country. Okay. I think because of the inflation and the economy situation at the moment, most companies couldn't really sponsor as much as they were doing before. So because of that, it wasn't as flamboyant as it was the years before. However, they still tried their best this year, but we would like to beg sponsors to sponsor more breast programs. And this year, the focus is not just October. It's now about what comes after October. So it's not just Pink Month comes, everybody talks about breast cancer, and then we all go back to our daily lives. Now, the program is going into every month, every day, talking about breast cancer. And this year, I noticed that there were a lot of individualized programs. Okay. So like a small group of ladies clubs and churches, they were all talk about breast. So it's more low key, but
very effective.
Very effective, yeah.
Oh, okay. So it looks like we've done well for ourselves. In terms of the statistics, are we seeing difference in it, or we're still getting the increased rate of breast cancer?
So in terms of the numbers, I'm not so sure. But from my understanding, it seems like we are picking more breast cancers. Okay. Unfortunately, we are still having people coming in later stages of the disease.
Which is the major issue, by the way.
Yes. But because there's more awareness, there's increased rate of picking up breast cancer. It might seem like a horrible thing, but it's actually a good news because now it means we are picking it up earlier than we usually do. But also there's still people who are coming in late. Now we'll pick people up early and then they get lost to follow up and then comes back later when it has
deteriorated, sort of.
Yeah.
Okay. All right. So that's just, an overview of how the situation looks like. And for all of you who have contributed to work throughout this month, you've done an incredible job for yourselves, and we want to continue with it. So please don't stop. It doesn't stop there. The men advise the women advise the men, because it's not just the women, and that's the thing that we almost forget sometimes. The men say, oh, we are not part of it. We are part of this. All right. So please do well to also check. But there are some myths. Doc, when we say there's a myth around breast cancer, what exactly are we looking at? And then we'll get into some of them.
Okay. So because there is a lot of information about breast cancers these days, there are a lot of misunderstanding or misconception about what like the information people are getting. So some people are getting creative with the kind of information they are giving. Other people,
I like that, creative.
Yes, because
I have a few creative ones. Yeah.
So, and as human beings, we also imagine things.
Yeah.
And that has fueled a lot of myths going around the country. So I think this year it will be good to actually deal with some of the misconceptions and the myths, so that we can reduce anxiety, and at the same time we can educate people properly about breast cancer. Okay.
The major one I want to start with is the fact that if you have a history, or if you don't have a history of breast cancer in your family, it means your chances of not getting it or getting it is either lower or it's higher. Does your history or your background has anything to do with this?
So your history of breast cancer is important. Whether you have first-degree family members or aunties or uncles that has breast cancer, it's important. However, from studies that has been done, only 5 to 10% of breast cancers picked up are actually hereditary, which means majority of people who actually have breast cancers might not have family members or relatives who has had breast cancer in the past. So you not having a family history of breast cancer doesn't mean you are safe from breast cancer. It's just a small amount of people, but it's important for them to get checked regularly as well.
Let's now talk about health, weight, lifestyle, alcohol, and all of that. Do they play a role in one getting breast cancer? Your health, your lifestyle itself in general.
So breast cancer, it's not just a genetic thing. Okay. Neither is it just lifestyle based. So it's a combination of different factors that comes together to put you at risk or lead to you having breast cancers. There are people who have lived a very healthy lifestyle and still end up with breast cancer. But having a so to say a flamboyant lifestyle in sense of drinking alcohol, sedentary lifestyle, being obese, have been shown to increase your risk. So they found more people with those having breast cancers. So it increases your risk, but that doesn't necessarily mean you get it. It's like a I like to see it as a lottery kind of thing. It's like when you buy more token, then the chances of you being picked is higher. So if you have all these risk factors, like you're adding more to your tokens, so the chance of you being picked or you having the breast cancer is sort of higher.
So it's important that one maintains their weight and all of that.
Yes.
So they don't get to that point.
It is very important to maintain good and healthy lifestyle. It protects you from breast cancer, and not just breast cancer, it protects you from other cancers as well. It reduces your risk of getting them. It also protects you from other medical conditions such as heart disease and diabetes. And there's been link between diabetes and breast cancer. They found that like having diabetes increases your risk of getting breast cancer. There was a study that was done.
Okay, that's a new one. I never knew about that. So that's really a cool one that everybody should be careful.
But the link is still not sure whether it's because you are obese that is increasing your risk, or whether the sugar level or the diabetes itself. So they're still doing more research based on that. Okay, all right. So
I think growing up, we used to hear about people who go to Kantamanto to pick, stuff from there, and there was it has to do with women, by the way. If you go and pick all those braziers, second-hand braziers and all of that from, those places, and you wear them and you're not careful, you get breast cancer, because some believe that there's been certain chemicals that have been used to treat them and all of that. And so, people were a bit scared and all that. Is it factual that if you wear bra, continuously, or from wherever you bought it from, there's possibility of you getting breast cancer?
There's no risk. There's no evidence to show that wearing bra or buying bra from Kantamanto or wearing underwire bra or anything increases your risk of having breast cancer. That's not true. Breast cancer, like wearing bra, it doesn't really matter. It's whatever you are comfortable in. Women are advised to get well-fitted bras, because when you wear very tight bras, you are likely to get swelling and pain in your breast, but it has no link whatsoever to breast cancer.
Okay, but then again, do you have to have a certain period of wearing the bra to just so you're able to protect it from other things? It might not necessarily be breast cancer, but wearing it continuously, or are women advised to, as it were, find times that they will not be wearing bra, and so it allows for fresh air and all that?
So your relationship with your bra is your relationship with your bra.
Okay.
Whatever you are comfortable in. If you are comfortable with just leaving your breasts as it is, well done. If you are comfortable with wearing your bra all the time, then go ahead and do it. Whatever you are comfortable with. The most important thing is that if you are wearing bra, make sure it is well fitted. If you have big breasts and you don't wear bra, there's been certain evidence that show that maybe it might, because of the weight, it might sag a little.
Okay.
But if you are okay with that, then you can do whatever makes you comfortable. Really, there's no health advice.
There's nothing like that.
Yes.
For wearing it continuously for whatever.
Yeah.
Oh,
whatever you are comfortable with. The only thing is, if you wear really tight bras, you are more likely to have pain in your bra, in your breasts.
Okay.
And you might hurt yourself and get something we call fat necrosis, which is basically just a scar in your breast. It will heal on its own.
It's not cancerous.
It's not cancerous. It doesn't have anything to do with cancer. Yeah.
Let's talk about the other aspect of using antiperspirant. Women, everybody, for example, but women, are they at risk for using, such things? Does it cause any thing as helping getting them to get cancer or anything like that?
So the antiperspirant one is a very interesting one, because it's not just in Ghana, it was all over the world.
Okay.
And the main reason why people thought, there's no link of antiperspirant causing breast cancer. And there are still studies going on to find out whether there is some component of the antiperspirant that can cause cancer. But I think people thought that because antiperspirant and deodorant contain some aluminum in it, there's a higher risk of you absorbing it, and then that's triggering you getting cancer. And studies done on it have found no link whatsoever to that. The only thing is that if you're going to do a mammogram, you are advised not to use your antiperspirant the day you are going, like 24 hours before your screening. The reason being that the chemical in the antiperspirant sometimes might interfere with the picture taken. And might lead to difficulty diagnosing or missing the diagnosis. So that's why it is advised. But because they tell people wait 24 hours without antiperspirant, people started thinking that it's because maybe it's causing cancer, but it doesn't have anything to do with cancer. Other people also thought when you use deodorant, you reduce your you don't sweat. So you keeping all those toxins in your body increases your risk of getting breast cancer. There's been no link whatsoever to that.
Okay, if you just joined us here on the show, this is Breast Cancer Month. We're wrapping it up for today, and we're looking at some myths that comes with breast cancer. And Dr. Suliat is here with me. She's helping us understand some of these issues that have come up. And if you have any personal one you want to share, You can also send it to us on our WhatsApp line, and she's going to answer them. All right. So if you have heard some very weird stuff about breast cancer, and even you've been trying to understand and you're not understanding, send it to us, and I'm sure Doc will be able to give you an answer to it. But so far we've dealt with a few of them, and she's been able to explain to us what exactly it is like and why it's not the way people think that it is. All right. So you can do well to also send us. Our WhatsApp line is very active, and you can send it on our social media page. We're streaming live on Facebook as well, so you can drop your messages there and let us know what you think about these myths that comes with breast cancer conversations. Now, when I was young, I remember my mom would always put her phone inside her breast, and then it will be ringing, and then it will be vibrating, and then I'll tell her that if the phone vibrates, where your breast is dangerous. It's something that you shouldn't be doing. I know most women also do. I've seen some families that, the old, especially these middle-aged women, old women, they'll just put it there in their mind. They're saving it. They're just putting it, in a safe place. But is vibration of the phone, has anything to do with breast cancer, or keeping it there continuously has anything to do with breast cancer? Okay, so there's not been any link found between putting your phone in your bra and getting breast cancer. However, phone companies and as advised against putting your phone close to your body, especially when you are not using it. The reason being, it's sometimes bring out heat, and you can burn yourself from it. Phone also generates very low waves of radio frequency, and there's no link really to breast cancer or any form of cancer yet, but they are still doing a lot of studies on it. But you putting it there doesn't mean you get breast cancer, but personally, health-wise, it is not advisable. I'm sure we've seen. So there are other factors that could come with using, putting the phone there, but not necessarily getting breast cancer. Yes. So they are still doing research on that aspect, but so far, there's not been any link between putting your phone in your bra and getting a breast cancer. But ladies, let's get a bag. Okay, let's get a bag. No, the funny thing, some have the bags, but they still prefer to put the phones there for whatever reason. I don't know, but some they have the bags, but they still prefer that they put the phone inside their breast, maybe hiding it. There have been instances where they put monies also there. I don't know what link that has to do with breast cancer too. Maybe it could be the same, like you explained. It doesn't have any link to breast any effect cancer. It's just that hygiene point of view, it's not hygienic really. Yeah, but apart from that, it doesn't have any link to breast cancer. Phone, they are still investigating, but so far, because I'm not sure whether you heard the myth about phone causing brain cancer and all those things. So because of that, they've done a lot of research about it, but there's not been any link with phones causing cancer yet. But the phone companies, to get themselves from any trouble, have said that you should avoid putting your phone very close to your body when you are not using it. Okay, let's talk about the other issue, which is sugar. Sugar, yes, maybe diabetes. I may just, say that there's a bit of link over there, but I'm not sure about breast cancer. Taking a lot of sugar, has it got anything to do with breast cancer? Okay, so the sugar one is a very interesting myth, because some people say that when you take a lot of sugar, then the sugar feeds the cancer, or so to say, makes your body eat a lot, and then you become cancer. Your body becomes sugary. So it's like a cancer easier. So it makes the cells grow out of hand and then forms cancer. And yes, sugar is the basic form of energy that all cells in the body use. So as the normal cells uses sugar, the cancer cells also take in sugar. Okay. To for their growth and survival. Having said that, it doesn't mean it causes breast cancer. Eating a lot of sugar has been linked to being obese. So that might be a link there in sense of being obese increases your risk of, getting breast cancer. But sugar itself
does not cause breast cancer. You are advised to reduce your sugar intake and avoid junk food and processed foods because of your risk of getting diabetes, and then also the increased risk of becoming obese from eating too much sugar. But there's never been a link so far linking sugar with breast cancer or any form of cancers.
Okay, now let's look at lumps and breast cancer. Does it always come with the lumps, or there are difference to it?
Okay, so for breast cancer, you might necessarily not have a lump in your breast. There's been instances where breast cancer has been picked in the armpit, where the lymph node was picked up rather than a lump in the breast. There are types of breast cancers that doesn't even come with a lump at all. Whoa. It might come as like a rash or an ulcer, basically like a wound on your breast. So having a lump in your breast doesn't mean, oh my gosh, I have breast cancer. Having a lump in your breast doesn't mean, oh, I'm 20, it's smooth, so it can't be a cancer. It doesn't mean that. So you having a lump, the lump has to be investigated further to decide whether it is breast cancer or whether it is other benign forms of, other benign things that are causing that, like other benign breast disease that is causing the lump. And there's this misconception, not just in the public, but among health sectors, that when I see a 20-year-old, a 19-year-old that has a lump in the breast, because it's smooth and movable, then it's definitely fibroadenoma, which is like a form of benign breast condition. Yes, most of the time it is fibroadenoma, but there are still instances where it could be breast cancer. So it has to be investigated appropriately. So if you notice a lump in your breast, please go to a hospital. Whether you're thinking it's breast cancer or not, it's something that you need to be checked. Having a lump in your breast doesn't mean you have breast cancer. Like, it's not like they've put a gun on your head that, oh my gosh, you have breast cancer or anything. So just get it checked out, let them investigate it properly, and then, if it is, then we'll deal with it.
Let's talk about the period of getting breast cancer in terms of age-wise, middle age, old age, the early stages and all of that. How is that dynamics like?
So breast cancer is more common among middle-aged people, most especially women and elderly. As you grow older, your risk of getting breast cancer increases. But there's a chance that you could have breast cancer at a lower age as well, like at age 20s. There have been instances where people in their 20s have been picked up with breast cancer. So yes, majority is in the older ages, middle and older ages, but then there's still that risk at the young age as well to have breast cancer.
One of the most important things that comes with the conversation of breast cancer is the fact that once you're diagnosed and once you're pronounced that you have breast cancer, it means that that's the end of your life, which goes within a lot of circles, because some people who are not even educated, when they hear this, it even scares them to even continue with the medication, because the person thinks that at the end of the day I'm finished anyway, so why would I even want to continue with this? Is it what it is? Is it factual?
That's not true. Breast cancer is one of the most curable cancers out there. And if it's picked up early and you follow your treatment plan, there has been, complete remission from breast cancer. Like there are a lot of breast cancer survivors out there. And it's not just something factual. It's not something that, because they are Aboche people, that's why they are surviving. Even in Ghana here, we have lots of breast cancer survivors. So if you've been diagnosed of breast cancer, it's not the end of the world. Fight. You can fight it. And the way you fight it is, we are a very spiritual country. Pray about it. Yes, I'm not saying you shouldn't pray about it. But fight it medically as well. Go to the right places. Go to a hospital. If you go to one hospital and they don't believe you, or they are not taking care of you as well as you want them to, go to another hospital. Don't say because you were shut down in this hospital, then I'm going somewhere else to go and get it treated, or I'll just decide to go somewhere which is not FDA approved to go and get it treated. Go to a hospital. Go to the tertiary hospitals. There's there's Kolebu. Kolebu has the major center for breast cancer in the country. But apart from Kolebu, you can also go to Trust. Trust has a cancer unit as well. So it's not just one place. So if you are not into the public sector, you want the private sector, there are places where you can go to and get treated. So fight it the right way. Fight it the right way.
There's been a lot of breast cancer survivors, I mean, no doubt about it, and you can also survive it. So if you've been hearing, people tell you, once you have breast cancer, you are dead, you're that, you're finished, you're not going to live, and all of that. There's a reason for you to actually, be very positive about it, because there are others who have been able to survive it. So if you're a survivor, you can send us your messages. Those of you out there who've also got some very weird things you heard about breast cancer and all, you can also send it to us on our WhatsApp line, on our social media platforms. It's Joy Prime TV. We're streaming live, and so you can send your messages there, and let's read from you, and let us know what you think about it. Is it something that you're dealing with? And if you're dealing with it, what are some of the things that you're hearing that scares you and it makes you very uncomfortable as well? You can send it to us here on the show. Doctor is still here with us, helping us understand some of the myths that comes with breast cancer. It's a breast cancer month, and we're wrapping up today here because Pink October, ends today. And so for those of you out there, it's not just going to end here. We're going to move on, even hereafter, and try as much as possible to educate ourselves and, do the right things so we can stay alive. Now, let's look at other issues. Implants and breast cancer. Some people have issues with it. What's the clarification on that?
Okay, so most implants out there are FDA approved.
Okay.
And there's not been any link of them to breast cancer. However, you're advised that when you have an implant installed, within the first 6 months, you should get a baseline mammogram done so that they know what your breast looks like with the implant, so that when you later screen for breast cancer, it's easy to compare with the first one you've done to know whether there's any abnormalities in it. There are some shady breast implants, the old type. Most of them actually have been off the market now, which has been linked to another cancer. It's not breast cancer, but it's called breast implant associated anaplastic large cell lymphoma. Okay. It's associated with like water collection around the implant and stuff. But because of research and modern techniques, they've kind of phased those kind of implants out of the system. So if you get a good quality breast implant that is FDA approved, both in Ghana and in other countries, you are most likely safe from all those things. So the most important thing is that if you have a breast implant, you should still do your self-breast exam. You should still get your mammogram. If you are now thinking of getting it, immediately before you get a mammogram done, like maybe the year before. 6 months after doing it, get a mammogram done, so that if God forbid you develop breast cancer, then they can compare it. They can easily pick it up by comparing to the baselines you've done to know whether there's anything, because it might distort the picture a bit.
Yeah. Okay. Is it the same with plastic? Using plastic?
The plastic. So with plastic is very interesting because apart from breast cancers, there have been other cancers and different things. And people say if you use black rubber, you get you get cancer. Some will say, oh no, the black one is the bad one, but the white one is not. And all. So there have been a lot of interesting things about plastics in general. So in the research world, there are different views about it. Some believe that there is no association between plastic and cancers in general, that there have been studies done about it where they found that although you might have some of the plastic in your body, but it necessarily doesn't cause cancer. So whether you heat it up or you eat food that was put in a plastic and all. Another set of study showed that certain components of the plastic can cause cancer.
Okay.
So, but most of those studies were done on animal studies and also on how do I call it? It's called in vitro, but like basically taking human cells and directly putting the chemical on it, like putting the chemical on it.
Okay.
So some people say because it's not done on a whole human being that is moving around, it doesn't mean it's credible. However, according to Breast Cancer Organization, it is there are some certain plastic that can give you cancer. Breast cancer. So an example of them is the ones that contain the BPA, BPA containing plastics. So BPA is like a synthetic estrogen. And estrogen, the more exposure you have to estrogen, the higher your risk, so to say, of getting breast cancer. The reason I'm saying I'm using risk is because it doesn't necessarily mean you get, it just increases your risk of getting breast cancer. So it's been linked that when you use BPA containing plastics, you might increase your chance of breast cancer. So that's why now people are advised to use BPA-free plastics and all. So there's still a lot of research going into plastics. So you can't say it's definitely a myth. Neither can you say it's a definite fact. So it's still a lot of research ongoing, but our advice, if you can afford, get BPA-free plastic so that at least you are safe from that headache.
Okay, very necessary. Now we're going to get to my favorite very soon. Yeah, my favorite myth. We're going to get that. But let me see, if you've got something you want to say, you can also give us a call, possibly give us a call and let us know what you think about the myths surrounding breast cancer and all of that. If you have any family member, if you have anybody who has come to talk to you about it, and the person has shared any of the things that we've mentioned, and you need a bit of clarity on it, you can send us your messages. You can also give us a call and tell us about it. Doc is here, and I'm sure she'll be able to give you an answer for you to be, free of all those things you've been thinking about that has been bothering you. Okay, so yeah, let's see if we can get a few calls and then we'll take it from there. Doc, this is my personal favorite. So over the period, and this has been a very long myth actually, because we were made to believe that it was the fact. Over the period, some men have taken advantage of the fact that breast cancer comes with women allowing men to make good use of their breast, because in their essence they are helping the women escape, or if you like, breast cancer. I don't know how many women have been able to escape that through that process, and and how the statistics looks like. But sucking a woman's breast, is this something that can totally avoid the woman from getting breast cancer, or we've just been played?
So I don't know who started that myth. I am sure it's definitely a man.
We're disappointed.
Definitely a man. So there is no truth to it whatsoever. And I think that myth stemmed from the fact that it's been said that when you breastfeed for a long period of time, or when you practice exclusive breastfeeding, you reduce your risk of getting breast cancer. So in a woman who just had a baby. Okay,
give me a minute. I'll come back to you. It is just like also saying that, and this is for the men. It's just like also saying that the more sex you have, your less chances of getting prostate cancer. I don't know what truth is there in that one too bad. Let me go on the phone line. Hello, good morning. I don't know what truth is there in that one. Hello, good morning.
Hello, good morning. Good morning.
So, can you lower the volume on your TV set?
Good morning, sir.
Please lower the volume on your TV set.
Men suffer from the. Okay, is it okay now?
Yeah, go on.
Yeah. Do men suffer from breast cancer?
Do men suffer from breast cancer?
Yeah, I want to find out.
Yeah, so, but you doc will explain more.
That's my question.
Yeah.
Yes, yes.
Okay, so please do well to lower the volume of your television set when you call, so it can help us have the conversation, okay? Once the volume is up, it's interrupted, and so please do well to lower the volume. Doc, do men have breast cancer?
Oh, yes. So men can get breast cancer. Although there are more women picked up with breast cancer, but there's in Ghana, for example, about 2.9% of breast cancer in Ghana are actually in men. Oh. So men also has a risk of getting breast cancer, although their risk is a bit lower than women's, but the risk is there. And majority of their risk factor is to do with drinking a lot of alcohol, obesity, hormonal medications, especially those, you know, I know we don't have much of this problem here in Ghana yet, transgender and all those.
Yeah.
And then also, if you have a liver condition, like a liver failure patient, or if you are taking certain medication, your risk of, you know, having breast cancer increases.
Okay. All right, so that's for the men. That's for the men. But before we went on the call, you were explaining the...
So I was talking about, you know, men sucking women's breasts, whether it reduces the risk or not. So the myth, like I said, started from nursing, like saying that, you know, if you exclusively breastfeed, you reduce your risk of getting breast cancer. So if you are, if you've just delivered a baby and you are exclusively breastfeeding, you produce a hormone called prolactin. And in the cascade of hormones in the body, it kind of reduces it inhibits the estrogen level in the body. So your exposure to estrogen is reduced, so to say. So if you exclusively breastfeed for 6 months, you've basically protected yourself from, I mean, you've reduced your level of exposure to estrogen for like 6 months. Okay, Doc,
give me a minute. Let me speak to Deborah in Swedru. Deborah, good morning.
Good morning.
Good to have you on the show. Please go ahead.
Please, I want to ask, like, if you feel any pain in your breast, is it like a risk, like you get a breast cancer?
When you say anything, what exactly are you talking about? Pains?
When you feel some pains in your breast.
Okay. All right, Doc is going to answer that for you, okay?
Okay.
All right, Doc.
Okay. So having pain in your breast is a symptom of a breast condition. It doesn't necessarily mean you have breast cancer.
Okay, so there are certain breast conditions.
Yes, so there are different breast conditions that can give you pain. Most common one is galactorrhea, which is basically, galactocele, which is basically, it occurs more in breastfeeding mothers, where the milk kind of forms in one side and can be quite painful. Or if you have an infection in your breast, you can also get pain in the breast. If you hit your breast on something or wear too tight bra and have kind of injured your breast, you can also get pain in your breast. But also it could be a sign of breast cancer. So if you feel pain in your breast, please go to the hospital. Let them examine you. Let them do a scan or, you know, imaging for you to make sure that there's nothing else going on and it's maybe probably just a benign condition. If you go, they might give you just a painkiller, or it might need more, you know, investigations or more treatment. So go to the hospital. They will decide on which kind of condition is causing your breast pain.
Okay. Then let me go to the line and see if we have another person. Rita, right? Hello, Rita, are you there?
Hello, good morning. Yeah, I'm here.
Good morning. Good to have you on the show. Please go ahead.
Please, I want to find out if you squeeze your breast and you find like you see a fluid as in the form of milk, is it by chance you getting breast cancer?
Okay, Doc, it's clear?
Yes.
Okay, all right. Doc is going to answer that for you. Thank you.
So, like I'm saying, for breast cancer, the symptoms you get for breast cancer are very similar to other benign diseases, like non-cancerous diseases of the breast. So having a discharge in your breast could be from breast cancer, but it could also be that you have other conditions. The most common one is ductal ectasia, which is basically the ducts in the breast collects some fluids, and then it leaks out through the breast. It could also be maybe you have hormonal, in her case, she's talking about milk in the breast, like white discharge, which could be milk. It could also be hormonal imbalance in the body, which has led to her producing milk from her breast. So unless she goes to a hospital and find out and do further testing, they can't really tell what is causing it. So she should go to a hospital. It doesn't mean she has breast cancer, but it could be that there's another condition going on that needs to be dealt with.
Okay. All right. So we're going to be wrapping up very soon, but we're going to take a quick breather. When we come back, we'll be getting into the other conversations that we have. But okay, so for the purposes of what we're doing right now this morning, and also making sure that we get to wrap up for the month of Pink Month, we're going to be asking 2 more questions, and then Doc is going to give us a final message for all women and men, because right now we are also heavily involved, women and men going forward, what we're supposed to be doing to make sure that we're taking care of ourselves and avoiding breast cancer. Doc, some of the issues you've dealt with for me, but let's look at the mammogram. The mammogram, is it also a cause for breast cancer? Some people think so. Yes.
So mammogram doesn't cause breast cancer. The level of radiation you are exposed to when you do a mammogram is very, very low.
Okay.
So it doesn't put you at risk of breast cancer. In fact, mammogram increases your chance of picking up any early cancer in the breast. Sometimes you might not have a lump, but the mammogram will pick up something abnormal. And when you do a mammogram, you spread the breast. Some people think maybe when you spread the breast, you push the cancer somewhere and allows it to go into the body. That's not true. It's just a small pressure on the breast. So mammogram in no way increases the spread of breast cancer. Neither does it increases your risk of getting breast cancer.
Okay. A wrap on the men issue. So the men and the breast issue. So basically, it's factual that it has nothing to do with.
No, it doesn't, because it doesn't have anything to do with breast cancer.
What about the kids feeding in the early stages?
So if you exclusively breastfeed, like I said, if you exclusively breastfeed, you reduce your risk of breast cancer because you reduce your exposure to the hormone estrogen.
Okay.
But a man sucking on your breast, it doesn't do anything to reduce the release of that hormone in any way. So it doesn't have anything to do with it.
Okay, so we've been deceived over there.
Yes.
Just
so
like
please,
that. All right, so don't hold on to that anymore. And don't be deceived by that anymore. Look, the whole of this month, we've, like I said from the beginning, we've tried. We've done what we could. We've been able to educate people and all that to make sure they get to understand what, breast cancer is and how they can also prevent themselves and even treatment and all of that. After this month, I'm sure a lot of people will be relaxed and all that. From you to the general public, what would you want to tell us moving forward, what we're supposed to be doing?
Okay, so... yes, October is breast cancer month, but it's not the end of breast cancer. So you can get breast cancer in any month. You can be diagnosed of breast cancer in any month. So get yourself checked monthly. Do your self-breast examination monthly. If you notice any abnormality, you don't have to wait till October. Come in anytime to see a doctor and get yourself checked by a medical practitioner yearly. Check your breast to make sure that you don't have breast cancer and eat healthy.
Okay, let's say a big thank you to Dr. Suliad Oyawoye. I love that name. I hope I pronounced it right.
Yes, you are.
Oyawoye. She's a medical officer from Medifem Hospital. Join us this morning for us to talk about breast cancer and wrapping up for the month of Pink Month as well. And whatever she said, I'm sure you've also taken a few things from it that you're going to, continue checking and checking and checking to be sure that you are also safe out there, because we need you alive. And this is for both men and women. We all moving forward have to do our best to ensure that we do not give breast cancer a chance in our lives. So